Well, good evening, everybody. Once again, we are here with the D Life podcast. And this week, we have a very interesting topic to talk about. We have a case study from Dr. Jasmeet Kaur. I'll give you a little background about who Dr. Jasmeet Kaur is. She has done her PhD in nuclear physics from Punjab University. Then she has worked in Europe across government projects for over 2 years. She came back to India. She has been awarded by UGC and other, distinguished honorary uh, government. Uh, is it District of Science and Technology? Is that what you are?
It's a Department of Science and Technology.
Science and Technology. Okay. So, we are talking to somebody who can understand research, but her interest and passion towards understanding, learning, and deep diving into low carb and high fat form of diet came out of a personal experience when her mother was diagnosed with diabetes. So, Jasmeet, you should introduce more about yourself and also, give us a little background about the case that you want to discuss on.
Yeah, okay. Thank you so much, Poshini, for the kind introduction. Thank you. So viewers, actually, my background is from, as Poshini already introduced me, that it's from nuclear physics. I am a nuclear physicist, and I did my PhD, and now I am into this low carb field. Particularly, like I actually particularly deal with the people who are suffering from the metabolic health issues like diabetes, hypertension, PCOS, and obesity. And I would say that I'm also a gut health specialist because I have the with many people with a different kind of the gut issues, starting from the acid reflux, bloating, IBS, SIBO. And today I'm going to discuss about one of my client who was suffering from rheumatoid arthritis, which is an autoimmune condition, and it's also more related with the gut. What I have seen from my experience that I am at present dealing with like 3 to 4 patients who are having this autoimmune disorders, and all of them they have some background like they had issues with their gut, like the constipation. Because if people have a chronic constipation, there is always a probability that you damage your gut with time. Or like the lifestyle nowadays, the people they are living like a sedentary lifestyle, and along with that other factors like the processed food and all that really damages your gut. That's why this autoimmune conditions, its prevalence is increasing nowadays. So this girl who was just I think around in their 20s, 26, 27 around, and she was married, and she was at that time planning a baby. But suddenly what happened that she got diagnosed with rheumatoid arthritis. Her symptoms starts to appear in January 2022, when she really start to see that she couldn't walk properly like the way she was doing before. Her activities, her day-to-day life activities are really, they're getting difficult to manage. And when in March, I think she went to a doctor, and the doctor did all the tests which particularly the doctor do for these autoimmune conditions, particularly for the arthritis. Because there are other autoimmune conditions also, like in that case your immune system attacks your connective tissues, that is we call lupus. And in some cases the brain cells, like multiple sclerosis. But in this case it's about the joints. And the rheumatoid arthritis, they do some tests that I will mention later if it's really important. And so yes, this is the case that we will discuss, Poshini.
That sounds very interesting. Rheumatoid arthritis has been on the rise. And one of the major, why don't you talk about what are some of the basic causes of rheumatoid arthritis? And if it is relevant to this case, maybe you can talk about what was the cause for her.
Okay. Actually, in her case, I think that the because the sedentary lifestyle, and that combined with the unhealthy food, that is the major cause in her, because she is working in a MNC, and her job was like from the 24 hours, either like 24 hours, 23 hours she was either sleeping or working on a laptop. And just for the 1 hour, like for the daily activities, she just jump from her chair or from her bed. So that was the condition, and her eating habits was very poor. And I think that's what typically damaged her gut.
Okay.
And that's the condition. But in other cases, stress is also one of the cause. Environmental toxins, sedentary lifestyles, and like the digestive issues that I mentioned earlier, these are the major causes which I am seeing.
मैडम है आपकी
That is absolutely spot on. There has been a lot of, I think, a neglected aspect. Cause is environmental toxins as well, as you mentioned, and yes, many of us do relate to being very sedentary.
Yeah.
I think you put it very wonderfully by saying that it is at least 23 hours out of 24 hours people are sedentary.
Yeah.
And when you put it in perspective like that, I think it adds a whole lot more. So why don't you discuss more about this case? What were the symptoms that she came with to you?
Actually, in the rheumatoid arthritis, the typical presentation of is like, the people, they start to notice the gradual onset of, like, it's not like, something really, it's explode just in a day or two, that you start to see the multiple joints are getting tender or swollen up, or you can't walk. It's never like that. It's always a gradual onset. And it's a spectrum of autoimmunity, and the immune cells which are now damaging your own body, they first start to, in this case particularly, they first start to attack the small joints like our knuckles. And the people, they find really difficult to form a fist. And these are the initial symptoms that people see. And also the people say, like, Arun Kumar also, he knows better about this. Like he mentioned in our discussion before we started this session, like, the people see that when they wake up in the morning, the symptoms are worse. And they see, like, they start to notice suddenly what happens is they couldn't jump out of their bed like the way they are doing before. And it gets very difficult for them even to get to the side of the bed and then climb from the bed. And when they start their daily activities, like their joints gets lubricated, and then the stiffness get better during the daytime. This is what is happening in this rheumatoid arthritis case. And the other thing is, this it's like when they are at the one end of the spectrum, like in the initial stages, when only the small joints are much affected. But people, they just ignore all of these symptoms. And the things goes on, and by time what happens is, when the inflammation really rises, and then the immune system really start to attack the joints like knees and ankles. And the situation, they really reach to a situation where they can't even move.
Yes. And you mentioned that this particular case in which we're discussing about, it started with smaller joints and it hadn't progressed to the bigger joints. Am I right?
Actually, this lady, she reached to the other end of the spectrum because she couldn't even walk.
Okay.
Yeah, because for her daily routine activities also, she needs somebody's help to move to the washroom and, other these things as well.
And at such a young age, that can be very disturbing for a person mentally as well.
Yeah.
Were there any other inflammation markers that you looked upon or took a look at, before you got her onto your program? And we'll discuss more on the program in a while.
Yeah, actually, that we are in the low carb field, and in our low carb approach, that our inflammatory markers are really reduced. And whatever we see, like even the diabetes case, even even any metabolic health case, we always look into the inflammatory markers. These are not the specific one, like ESR, CRP, these are not the specific marker for the autoimmune disorders. But when it comes to the autoimmunity, and there are other autoimmune disorders, but for the rheumatoid arthritis, there are two specific markers. One is R factor, in which the antibodies are formed in the body against immunoglobulins IgG. And IgG is which actually prevent us, or these are actually the antibodies that prevent us from any kind of infection from pathogens or viruses. And R factor is an antibody against this antibody.
Okay.
there is another test, anti-CCP, which even I don't know much about because I have read about this anti-CCP yesterday only. But I haven't asked my clients to do this anti-CCP, and it's a very expensive test also. So, but actually, when we have symptoms, and symptoms are already there, and R factor is already elevated, even in some cases, R factor is normal, but they have symptoms. We see the other markers like CRP is high, ESR, which is a chronic inflammatory marker, is high. So we just, start with the strategy of our approach. But it's good to have some baseline measurement, I would say.
Okay. Will we be able to discuss on the baseline measurements and the improvements that you saw in this case, or?
Sure. I will just show you.
Maybe we can see the baseline measurements. While you're sharing your screen.
I will share a screen where I have just put on all the markers.
All right. Yeah.
So these are the one which I was talking about. This lady, she had first test in January 2022, and I think she joined with me in April.
Okay.
And she joined with me in April, but what happens is her when I put her on elimination diet during the elimination phase, in the first month itself, her symptoms start to disappear. The inflammation start to reduce. Inflammation in the sense like she was having swelling on the knees, ankle, like they're very much swollen up. Inflammation started to reduce within a month, but we did the final test in July.
Okay.
And she started with me when her RA factor was around 396, and her anti-CCP in January 2022, it was greater than 200. She didn't test again because I don't know, for maybe for some reasons, because there was already RA factor was elevated.
Right.
Because doctors sometimes do anti-CCP when people have symptoms, but R factor is normal. Then they look into anti-CCP, which is more specific as compared to RA factor. So that was a baseline measurement. And in July 2022, it was around 102, still high, but her symptoms were completely disappeared. And what happens is, Poshini, actually, I think I mentioned that this lady, she was planning a baby.
Yes.
When she came to me, and her doctor said that first your inflammatory markers should reduce all the symptoms, like there is really a very high inflammation. First you treat that, and then you can plan. And I think that within a month she conceived because her symptoms disappeared. And I think a few days back only she had a baby girl also.
Okay, that's
yes. So I asked her many times to check her RA factor, but she said no, I don't want to, because there are nothing. I feel like I have something, because she was into something else. Like she has already conceived, so she don't want to get into this RA factor again, because she was saying no symptoms are there. She's happy with what with her health. So that's all about this. And anything else would you like to know?
Yeah, maybe one more thing that you can tell us about. I mean, we can see the significant difference in the markers from March to July. And you said she started somewhere around April. And in month, she saw a lot of symptoms going away and completely disappearing. So what were the primary symptoms, one, and how strict was she with the protocol? And in terms of, was there also any other contributing factors in which the doctors had advised her, and what were the medications she was on prior to getting started?
Actually, Koshini, this girl, she's one of from my relatives only, but she didn't come to me. The thing is, because she don't want to change her diet. Okay. In January, when she contacted me first time, I asked her that, of course, I will, we will follow the lifestyle interventions, because there is nothing like medications that I can help with. But she said, okay, first I will try with the medications. She tried everything starting from this conventional medicine approach, like allopathic medicine, where she took everything like from the painkillers, anti-inflammatory drugs, immunosuppressant drugs, and maybe doctor also prescribed some supplements also, like B vitamins and all, like omega-3. Doctors also prescribed all these supplements. And then she started with the homeopathic medications also, but she could never relieve from her symptoms. Like in some cases, I know that people really get relief with the medications, but in her case, she just like 5 to 10%, like we just, can't count that.
Yes.
So that's why she came to me, because she tried everything. And when she couldn't even move, that's why this is the reason.
So basically, the January to March readings that you're showing up here on the screen right now is intervention with allopathic
Doctor. Yeah, with the doctor.
traditional medication route that was given. Okay,
Yeah.
so there has been a slight increase in the inflammation markers, and as you rightly said, in some cases it doesn't really help all that much. Symptomatically, also they do not find relief. How and it is astonishing when you hear, right? Within a month, things changed and the numbers speak for
Yeah,
itself.
actually, I haven't shown here. When she started with me, after 25 days only, she checked her R factor. I asked her, no need to check because symptoms are already getting, elevated. So why don't you wait for at least 3 months? She said, no, I want to check. So at that time, she started with 396. At that time, it was around 250.
Okay. That's a significant drop.
Yeah.
Significant drop in just 25 days, you're saying?
Around 25 days, less than a month.
Less than a month. Oh, wow. Okay. That does, translate to a lot of symptomatic relief. I think ease of life would have drastically increased. Why don't you share about her journey towards conception and pregnancy? Was she still on low carb diet?
No, she's not on low carb. Actually, that we people ask them to, it's like a lifestyle change, but, people don't listen to this. The thing is, in her case, what I followed is I put her on the elimination diet first.
Okay.
And during the elimination phase, what we do, as the inflammatory markers were high, so we first eliminate all the inflammatory stuff. Like the gluten, even the cow dairy is really inflammatory, and the thing is lectins. So all the legumes and lentils, and even nuts and seeds. As this lady, she was, there is a approach, autoimmune paleo approach, which anybody just Google and they can just start following that diet. But we, as a low carb consultant, I don't do this particular autoimmune paleo approach, because in that case also, because whenever they have in such case or any other situations as well, we just don't focus on what not to eat, because in autoimmune paleo approach, they have one elimination kind of things. People just eliminate all those stuff. But what to eat is also equally important here, because we have to focus on the nutrient dense food. Because as what I consider is, it's like a leaky gut case. And if your gut is leak, we have to focus on something that can heal their gut, along with, because when we eliminate, it's like we are not sending much more of those damaging things, but we have to send something which can actually really heal it. So during the elimination, we focus on what not to eat and also what to eat. So we actually see the nutrient dense kind of stuff only. And that what we people do, because the low carb is also, it's about the nutrients. We are not omnivore, we are not carnivore, we are actually nutrivore. So this is the approach that we follow. So
I think I like that term the most, because omnivore, carnivore, and all come with so much of stigmas. But this nutrivore is definitely my favorite word right now. Thanks to you, because that's exactly what it is. It's the nutrition that matters, irrespective of in what source it's coming about. As long as your body is able to absorb it, assimilate it, and it proves beneficial in perhaps, as you mentioned, healing things that have gotten damaged. I think that is that is the best place that we need to look at. Is there anything else that you learned during this case, Jasmeet, that you'd like?
Actually, like I mentioned, that during the elimination phase, and then we have a reintroduction phase, and that is very important, and that is a really personalized approach. When we really start to introduce the stuff that we have eliminated, at that time also we have to focus more on the nutrient dense part. For the first thing that I add is always eggs, because for some people eggs are really inflammatory. But the thing is, when the inflammation is already there and the inflammation levels markers are high, at that time, some of the healthy stuff also, there gets to really harm our body. So the first thing that I add is eggs. So because when the inflammatory markers gets reduced, what happens is we have more freedom for the food now. We can then add accordingly. So first we add eggs are good things, like now the nutrients from the nuts and seeds. If the people they are vegetarian, then that's more important that we should add some nuts and seeds to their diet. And then we focus, of course, fermented dairy is okay for many people, but then I add some fermented dairy as well, like curd and then cheese and all these stuff. And the thing is, it's what I wanted to tell you is during the reintroduction phase, what happens is what people do is they just add one thing first week, and the second week they add the other thing, and after a few days they start to add. But it's not like that. Some people, they really don't show instant effect. In that case, it's a cumulative reaction. You just add eggs first day, doesn't show any negative flare up, no flare, and maybe after a few days or maybe after 15 days you start to see another flare. So I tell people that when you add any healthy stuff during the reintroduction phase, just wait for a month and then reintroduce the another stuff. And in this particular case, what happens is now she is eating everything.
Okay.
Even gluten, all kind of grains. And, in the autoimmune paleo diet, also some kind of grains, like some kind of loads are allowed. But we as a low carb, I never suggest people, to look for other options for the grains. Because we look into the overall health of people, like metabolic health. As this lady, she was also obese. And in 3 months, I think she lost around 8 to 9 kgs.
Okay.
Yeah, she was just 155 centimeter and her weight was around 68 when she joined me.
Okay. And I'm glad you brought this up. Along with these inflammation markers, and the gut issues, were there any other issues that she came with? Since you also mentioned she was slightly on the overweight side.
Yeah, she was overweight and her fasting glucose level when she joined was around 1 or 2, which is not a good level for, it's we consider it as a pre-diabetic. And her, I think HbA1c was also around 5.5. Now it's below 5.
Okay.
So yeah, everything improved. I think, I don't know how, but even I don't endorse such kind of things that people add everything back like what she's doing. But it's now their life. Our duty is over. But still, I say that one should not add all the gluten stuff. Once in a while is okay, because now the inflammatory markers are down. You can add once in a while, even you can cheat with the sugar or any other stuff. But if you keep on increasing or if you indulge this on daily basis, I really bet that inflammation will definitely come again.
Cumulative effect, as you mentioned. Yeah. This is really great to hear about this particular rheumatoid arthritis, because a lot of people do consider that autoimmune equals lifelong medication, and it's great to know that low carb nutrition with high fats can really help these inflammation markers, as well as help with a lot of symptomatic relief, life becomes easier, and I think that does matter a lot. But as you said, after a point, there's only so much that we can help.
Yeah, I think Poshni, you're right. And these people who are on the medications of any autoimmune disorders, even though they know that they have to take these medications for lifelong, if the symptoms are elevated, they're very happy with the medications, and it's really a shame, I think. They don't go for these lifestyle interventions. I don't know why people are like this, but they're ready to take all these anti-inflammatory drugs, and I think that they will reach at a stage definitely in their life when the side effects of these medications will be more is like more over this their main issue. They will create more harm than what they are really suffering from at present.
True. I think you rightly said. Is there any other autoimmune cases that you may want to just, share a little bit about? Because, before this call, we were talking about the other cases that you were handling as well. Maybe a brief input, and then we'll open it up for questions with others.
Yeah, there are other two cases, but these two people, they came to me at very initial stage. Like they have more of the pain on the inflammation on the smaller joints, like the knuckles. Right. And their R factor is also not that much high. I haven't tested for this anti-CCP because already the symptoms are there and R factor is already high. Like it's more than 10. But in the normal cases, I see that the R factor remains like 4 to 5. In this case, in these two cases, R factor is around 15 or 16. But they have pain in their knuckles, and it's worse in the morning. This is the main, I think, the typical symptom I see in the rheumatoid arthritis cases. Like they have more inflammation in the morning. Yes. And this is with movement, the things are getting better. That's why the sedentary lifestyle is also one of the major cause of this autoimmune disorder. And in these cases, because these people, they are young. One is just, I think, 31-year-old guy, and he's also working in MNC in Chandigarh. And in his case also, what happens is he said just 15 days back he started to notice that he's having pain in his knuckles. But he was also vegetarian at that time when he arrived, and I asked him that for the time being it's okay, but for after a month, when your symptoms will be really get better, then I will start to add eggs. So he agreed on that. First of all, I eliminated everything, all the stuff that I mentioned earlier, and now I put him on eggs. And with eggs, he's doing really well. And because the people, another case, in his case, LFT, the liver enzymes were also very much elevated because he was having diet Coke, sodas, and all, everything. So I think that will also improve, because I haven't tested after 3 months. Of course, I will get her all the tests done, but the symptoms are no doubt day by day improving.
That's great to hear, because yeah, I mean, we are definitely looking forward to the other case study in some time as well.
In the other case, I would like to mention this person, he didn't join with me, but somebody, one of my client, he discussed with me that they know somebody and he's suffering from multiple sclerosis.
Okay.
And when I tried to find out the root cause of his problem, he said that he was having a chronic constipation since childhood. Right. See, again here the gut issues came into picture, So he was having chronic constipation since childhood, and at the age of 21, he was diagnosed with multiple sclerosis. And he said he's doing with the very good with the medications. He's working with some doctor in PGI Chandigarh.
Okay.
So yeah.
Yes, I mean, as long as it's helping them, we don't definitely wish anybody harm. But as you said, lifestyle interventions do have unparalleled, advantages, benefits without side. But I think that way D-Life is doing a really great job in educating people, offering diploma courses, and because knowledge and information and the right information is lacking. A lot of Western information can be very conflicting and confusing for our Indian diet. And D-Life really does stand remarkable on this aspect.
Yeah.
So I think I'd like to open up the session for more questions from others. Anybody has any questions to ask Jasmeet, feel free to perhaps unmute yourself, and Jasmeet would be happy to take on more questions right now.
Yeah, sure.
Jasmeet, Shashi here.
Yeah.
So, how far is wheat, gluten, and dairy involved in autoimmune disorders? You think eliminating one or both are useful?
Actually, cow dairy is more inflammatory, what I have seen, because the people who were on cow dairy before, I put them on the buffalo and more of the fermented dairy. What we people, like promote like the fermented one, not the pure lactose like milk. I stop all the milk products directly, like pure like lactose, and then I put them on the hung curd, where the quantity is also quantity matters. Sometimes it's a cumulative effect. So I think without the animal products, it's really difficult, Shashi, if the people, they are vegetarian, you know that.
I'm asking because there has been a lot of noise on this.
Yeah,
especially
yeah.
in the autoimmune.
No, but
space. So I was
in
a little
my
curious
cases,
to
there
know.
was, no issue with the dairy.
Fine. So wheat gluten appears to be very strongly
Yeah.
associated with this autoimmune condition. Of course, gut is there, of course, so gut healing strategies has to be adopted.
Mhm.
When anyone has a question, they can ask.
Wheat gluten does create a lot of irritation for the gut lining, whether a person's metabolically healthy or not. So I know I'd like to second on what Shashi said. That is, yeah.
Because and we have seen off late last couple of years there's a rise in autoimmune condition. Don't know why. But definitely there's a lot of, even my orthopedic surgeon was telling that he's seeing a lot of patients with autoimmune condition. Though technically they may not see this rheumatoid condition, but when a patient comes with some bone and joint issue, and when it tests, there is a lot of autoimmunity conditions which are happening.
And Shashi, even I think sometimes, people, they're just related with the osteoarthritis, and it's very different. It's different from the, rheumatoid arthritis. That's a stage. That's why, the people really delay with the lifestyle changes.
Jasmeet, I think I'll ask you one more question on top of this. Most of the cases you discussed were really young people. How different would the protocol be for somebody who's about 60, 65?
Yeah, it's, I haven't seen any above 60 years, but if somebody with, it's very much important, age dependent, and the history. Since how long you have that issue, that is more important. How much damage has already been done. And like in this case, you have seen that this lady, she has, already reintroduced almost everything I eliminated. And she's now doing well since I think last 6 months. But if it's somebody like who's already, aged, in that case, I don't think so. With the reintroduction phase, we can have more freedom with the food. So that would be the one thing. And of course, like, the people, when we put on the elimination diet, the nutrients are very important. It's difficult to deal with the people like they are already nutrient deficient. And, I usually ask people to have organ meats. Because the main nutrients which are important in this case, I have seen that vitamin A, vitamin E, all the B vitamins, particularly B3, B12, folate, zinc, carnosine particularly, and even the coenzyme Q10. And the place where I live, I think that it's difficult if the person is really, above 60, because, they are really very much, rigid about their, they have some emotional kind of things up with their food. Yes. But one thing everybody can have is like, bone broth. Yes. Bone broth is the first thing I try to, add during the elimination phase from the first day itself, if somebody really can do that.
I think that's really good. Because as you rightly said, people who are slightly older tend to be very emotional about their food.
Yeah, that's the thing.
Yes. All right. Any other questions we have for Jasmeet?
Jasmeet.
Yes. Yes, Arun Kumar.
Have you tried turmeric and garlic in case of rheumatoid arthritis?
Yes, I have tried various herbs. Turmeric is one of them. Garlic, no doubt. Yes, ginger, and yes, these are the major which are readily available. And I ask them. Even I think almost all of my clients, even if they are suffering from any kind of issue, I put them on turmeric because inflammatory markers, they are always high, even if they are obese or they are diabetic. Turmeric is one of them, and ginger, yes, and yeah, garlic.
Okay, thank you.
Mhm.
I guess this wraps it up, unless somebody has any other question you would like to ask, Jasmeet. All right. So, thank you, Jasmeet, for sharing this. Of course, apart from your PhD and all your research work that you've done, you've also had, your education through the diploma course, which is
Yeah,
NAC accredited as well. So
yeah.
that has definitely, I'm sure, added a lot of value. Uh, would you have handled this case differently had you not had that diploma background?
Of course, of course. Our diploma course, it's quite different from what other people are doing and what we have learned, and we have acquired a lot of knowledge, and all thanks to Anup. And it's good that you brought this up. At the end of this, I would really like to thank Anup, and he is the inspiration along with Shashi and Arun, and they have always inspired us. And the thing is, they are always there with us, whenever we have any kind of issue or any kind of doubt with our cases, they're always there to help us. And Anup, he has designed a course in such a way, like, we started with the metabolic health, but he has covered each and everything related with the human physiology in that particular course that we all have done. And I know that the our diploma course, it started with the digestive health, and where we have learned everything about the digestion. And that has really helped me. I have gone through each and every article that he has posted. And it's more of like, very vast information is given. That's why, today I am able to handle not only the cases with the metabolic issues, but the other issues as well. I can now confidently say that I am a gut health specialist. That all thanks to Anup. It's all because of that course. And when I was doing that course, Porshini, I never see like, I have to finish this course in the 5 months or 6 months. I never, it's like, I spent a lot of time in on each and every part of that course, and I have get into everything, really. That's why, this is really, I really, encourage everybody, if you are really into this field, to at least once go and look into it. And I think that will be really profitable for you people.
I totally agree on that, Jasmeet. I was very ambitious when I took up the course, thinking I'll finish it in 12 weeks. But, I finish each chapter and I can't wait to get into the articles and the vast information, because I think if you skip out on that, you do miss out a lot. And as you rightly
Yeah.
said, Anup, Shashi, and Arun have really contributed majorly into this. And uh, I'm looking forward to the kind of confidence that you're having for myself, since I'm
Yeah, of course you will have this the same or maybe more than this.
all right. Anything else? Anybody wants to add? We can wind it down. All right. So I think with this, we're done on this. Thank you so much, Jasmeet, for giving your inputs on this particular case. And if anybody who has rheumatoid arthritis and would like to take a look at what you need to do, you can get onto D-Life, or you can reach out to Jasmeet itself. And we sincerely hope that you can choose a lifestyle intervention for your issues in whatever issues that you have in your health, because I sincerely believe that lifestyle related, if you make changes at lifestyle level, you do not require intervention from any other sources that can complicate things further for you, because chronologically we are all aging. That itself is a side effect to living. We don't need to
Yeah.
add on new things as a So I think we can wrap up the session with that. Thank you so
Yeah.
much.
Thank you, Poshini. Thank you so much.
Thank you very much.
Thank you, boss.